Thank you all for joining us for this webcast, which is brought to you by the Knowledge Translation for Employment Research Center, or the CATER Center. We're housed at the American Institutes for Research, and I'm your host, Ann Outlaw. This project is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR. Before we begin, I'd like to go over some logistics for our listeners. You can find information, including a 508 version of the presentation slides, on our website at kter.org. Closed captioning is available by selecting the CC button at the bottom of your YouTube window. And this is an on-demand webcast. So if you have any questions for our presenters today, please email me at aoutlaw@air.org, and I'll convey these messages to our guests. You can also ask your questions in the evaluation form, which I'll provide later at the end of today's webcast. Today, we'll hear an update from the project, A Multidisciplinary Approach to Translating New Knowledge into Practice to Promote Health and Well-Being After Spinal Cord Injury. This project is one of a handful of projects funded by NIDLR for translating disability and rehabilitation research into practice. These are exciting projects as they really practice knowledge translation strategies in tangible ways. At the CATER Center, we take time each year to share how these projects are doing, and it's my pleasure now to share an update from this project. Today, we'll hear about the individual tools for assessing risk of unintentional injuries among those with spinal cord injury. Joining us today are Cao and Cao Li from the Health Sciences and Research Department at the Medical University of South Carolina, or MSUC. Dr. Cao, are you ready to begin?
Yes.
Great, thank you.
Okay, thank you so much for having me. And I will first to introduce the study. And this study was supported by the National Institute on Disability, Independent Living, and Rehab Research. And we have two purposes for today's presentation. First, I will first describe a study of behavioral factors and unintentional injuries after spinal cord injury, which is forthcoming in the archives of physical medicine and rehab. And then Dr. Li will present the two individualized tools based on this study. The first tool is to assess the risk of fall-related injuries, and the second is to assess the risk of non-fall-related injuries. A little bit background. We know SCI is a traumatic injury that may result in permanent sensory and motor loss. And unintentional injuries are one of the leading causes of healthcare utilization, disability, and mortality in the United States. And the people with SCI are more vulnerable to subsequent unintentional injury due to the existing disability, spasticity, weak muscles, and because a pattern of high-risk behaviors often leads to SCI, and these behaviors may continue after SCI onset. For this study, we have 4,670 participants who met the following inclusion criteria: traumatic SCI of at least 1 year duration. They are at least 18 years of age, and they have a residual impairment from SCI. And all the participants, they completed a self-report assessment during 2012 to 2016. We measured demographic factors, injury characteristics, and the behavioral factors. Our outcome measure is self-reported number of times in past year they had been injured seriously enough to receive medical care in a clinic, emergency room, or hospital. Based on the information, we classify the participants into 3 categories. First, not injured at all. Second, injured with at least 1 fall-related injury. And third, injured but with no injury related to a fall. Then we developed a multinomial logic model to identify the risk factors associated with the 3-category unintentional injury outcome. Here's the results. We found 23% of the participants reported at least one unintentional injury in the past year. And among these participants, the average number of times injured was 1.8. 11% of participants reported at least one fall-related injury, and 12% of participants had at least one injury, but none of them is fall-related. Then we have 4 tables. Those tables basically show the multinomial logistic regression. And because they are very busy, I will not go through them in details. Because Dr. Li, when he presents the calculators, you will see all those predictors. And if you have interest to this table detail, you can look at our PowerPoint later, or you can look at our publication forthcoming. So I just give a brief summary of those tables. First, present the prescription medication use for pain and depression, non-medical substance usage, prescription medication misuse, and binge drinking were associated with greater odds of unintentional injury. And we also found that there were some differences between fall-related and non-fall-related unintentional injuries, especially the ambulation associated with greater odds of fall-related injuries, but lower odds of non-fall-related injuries. And here's the link to the individual tools. Dr. Li will present those calculators. And if you have interest for our publication, and it's forthcoming, I think next month. And right now, I will turn it over to Dr. Li.
Thank you, Dr. Cao. My name is Cao Li, and I will continue to present our 2 calculators. As mentioned by Dr. Cao, we have 2 injury calculators to present today. And the first one is fall-related unintentional injury calculator, and the other one is non-fall-related unintentional injury calculator. And first, let's take a look at the fall-related unintentional injury. And here we can see a set of variables we included in the calculator. For instance, we have sex, characterized as male and female, and also current age. We can tap in the age here. And also years post-injury, we can tap in the actual years post-injury. And then we have walking status, which was categorized into 3 groups. I cannot walk at all, and I can walk, but need at least one person's assistance. And I can walk, but I can walk without others' assistance. Then we have the SCI injury level as cervical, thoracic, lumbar, and sacral. And then we have 4 categories of race ethnicity: Hispanic, non-Hispanic white, non-Hispanic black, and non-Hispanic other. And for income, we categorize it into 3 groups: less than 25,000, 25,000 to 75,000, and over 75,000. And also we have the self-perceived weight. It can be underweight, a bit underweight, average weight, a bit overweight, and overweight. The next factor we have here is binge drinking. It is considering all types of alcoholic beverages. How many times during the past month did you have 5 or more drinks on one occasion? And the options are none, 1 to 5 times per month, and 6 times or more per month. And the next variable here is substance misuse. Basically, we ask in the past 3 months, did you use substances including cannabis, cocaine, and so on and so forth, for which you did not have a prescription? And we dichotomize the option as none, not at all, and yes, at least one time. And then the next 4 questions asking about prescription medication use. For instance, the first one is, in the past 12 months, how often did you use prescription drugs for spasticity? And the next one is for prescription drugs for sleep. And then the next one is prescription drugs for pain. And then prescription drugs for depression. And the last variable factor we have here is if they use their prescribed medication for other symptoms. For instance, if they use spasticity medication to help with other symptoms. For instance, problems sleeping, pain, anxiety, and depression. And if they have any kind of this situation, they choose yes. If they don't, they choose no. And then once people pick all the variables, choose their options, and then click calculate, the calculator will give us the personalized risk of fall-related unintentional injury. And at the bottom, we have a brief introduction of the calculator and also the list of variables we included in the model, and also source of data and calculator limitations and disclaimer, and also the reference. So next, let's try to choose some characters, mock characters, and see how the calculator works. First, let's just choose some very basic characters with low risk profile and see how the risk will be. First, let's just choose male, and the current age, let's type in 50 years old and 10 years post-injury. And first, let's see if people cannot walk at all. And injury level is cervical, non-Hispanic white, and 25,000 to 75,000 income, and average weight. And let's assume they don't have any risk behaviors. In this case, no binge drinking, no substance misuse, and no prescription medication use. And no here. And then once we hit the button calculate, it will give us the personalized, individualized risk of fall-related unintentional injury. And here we have here is based on several assumptions, the probability of at least one unintentional fall-related injury we expect you have in the next year. And also we have, we compare one ratio here. It is the individualized risk over the average risk. And here, for instance, here, the average risk of fall-related unintentional injury is 10.7%. So basically 2.36% over 10.7% is 0.2. This is the ratio. And also at the bottom, we have a very general, we give general information here about the prevalence of risk of fall-related unintentional injury. As mentioned before, the average prevalence of fall-related unintentional injury is 10.7%. And also we give the prevalence of the risk in terms of the 3 groups of walking status. For instance, for people who can walk independently, the average risk is 13.3%. And for people who can walk but need assistance, the prevalence of the risk is 26.5%. And for people who cannot walk at all, the risk was 8.2%. Okay, and then next, let's see choose different characters to see how if we choose different options, what the difference will be. We can just refresh the page. Oh, what? Okay, here we go. This time we still choose male, the same age, same years post-injury, but this time we can, let's choose I can walk, but need at least one person's assistance, and then change the injury level to thoracic. And all the rest we choose the same characters. Average weight, no binge drinking, no substance use, no prescription use. And let's see how it looks. Now we can see the risk of fall-related unintentional increased to 8.12%. And it means for people who can walk but need at least one person's assistance, they have more risk of fall-related injury than people who cannot walk. And this time, let's choose people who can walk independently to see how it looks. Similar male here, 50 years old, 10 years post-injury, and then we choose I can walk without others' assistance. And same thoracic injury, non-Hispanic white, same income, and everything is the same. And let's see. Now the risk is 4.69%, which is lower than the people who can walk but they need assistance. So in other words, people who can walk but need assistance have the highest risk of fall-related unintentional injury. Next, let's see if we choose some high-risk behaviors. Male, 50 years old, 10 years post-injury, and let's see people who can walk but need assistance. Thoracic injury, non-Hispanic white, average weight. Now let's choose for binge drinking, let's choose the highest level of binge drinking and then keep the rest as negative. And then we can see the risk changed from 8% to about over 12%. And we can see if they have been drinking, they have more likely to get injured, unintentional injury related with fall. Next, let's change our choice to a more risk behavior for substance misuse. So similar here, male, 50 years old, 10 years post-injury, they can walk but need assistance. Thoracic injury, non-Hispanic white, middle income, average weight, and they still do binge drinking, and they use substances. And for prescription, for now we just choose them as never. And now once we hit the calculate button, see the risk change from about 12% to 18%. Now we can see the substance use variable can make a big difference here. Okay, next round, let's choose yes to the prescription drugs. And so this time we use all the risk behaviors. And male, 50 years old, 10 years post-injury, walk but need assistance, thoracic injury, non-Hispanic white, middle income, average weight, they do binge drinking, they use substances, and they use prescription on daily basis for spasticity, for sleep, for pain, and for depression, and they use their prescribed medication for other symptoms. Now we can see a dramatic increase of risk from about 18% to 58%. And we can see the prescription drug play a very critical role here. And the ratio compared to the average is greater than 1, 5.5. Okay, that's pretty much for the fall-related unintentional injury calculator. Next, let's take a look at the non-fall related unintentional injury calculator. Similarly, we have the same set of variables here, except we change the outcome variable from fall-related unintentional injury to non-fall-related unintentional injury. And for this calculator, we use, as mentioned before, we use the same set of variables. We just change the estimates, and then the algorithm would be different than the fall-related. For a simple example, let's just choose male, 50 years old, 10 years post-injury, and they can walk but need assistance. Thoracic injury, non-Hispanic white, middle income, average weight. They do binge drinking and substance use, and also daily prescription medication use. And then we can see the risk of non-fall unintentional injury is 25.92%. Yeah, but when we do the fall-related calculator, the risk was about 58%. We can see we're using the same characters, but fall-related injury has higher risk than non-fall-related injury. All right, that's pretty much what we have today for the two calculators. And thank you very much for your time and attention.
Thank you so much, Dr. Li and Dr. Cao, for sharing about your new calculators. We heard a little bit about these as they were being developed in a previous version of this webcast in this series presented by Dr. James Krause. So it's great to see the work that you've been doing in the last few months. It's really taken off. Can you share with us how practitioners and people with SCI can access these calculators?
Yeah, sure. We will post our calculator online, and this is the link to our webpage. And once we post it, and people can have access and use our calculators.
Excellent. Thank you so much. We'll be sure to include this on the information on our webpage, so audience members of today's webcast can have access to that link. Again, you're welcome to download the slides where the link is as well, and to find more information about today's webcast. So thank you again, Dr. Cao and Dr. Li, for sharing this update about your project. Before we close, I'd like to invite you all to fill out a brief evaluation form of this presentation. You can find the link here on the slide, and you can also find it on our website at cater.org. You may ask your questions for Dr. Li and Dr. Cao for following this presentation, and I'll be sure to relay those questions to them. If you'd like a response to these questions, please put in your email address and I'll get back to you as soon as I'm able to. So again, thank you so much for participating today. Thank you both for your time, Dr. Li and Dr. Cao, and I'd like to thank NIDLR. I'd like to thank NIDLR for their support for this presentation and for all of our center's activities. So thank you and have a good day.
Thank you.